Welcome, everyone. My name is Lola Rain, and I'm with Sequoia Living. And today's webinar is with Dr. Claude Nguyen, and we're going to be discussing stroke prevention and awareness. If you're watching live, it's November 9th, and we are going to record today's presentation and share it on our YouTube channel, as well as in our communities with our residents. Dr. Nguyen is a vascular neurologist, and he'll be joining us shortly. But first, I want to thank our sponsor, which is Senior Services for Northern California. Senior Services for Northern California is the philanthropic foundation of Sequoia Living. And they work to fund programs such as the San Francisco Senior Centers, which we have one in the Tenderloin District of San Francisco, as well as at Aquatic Park. We have a wonderful volunteer program through AARP called Experience Core Bay Area, and that's where older adults read to school-age children. We also offer a resident services program to affordable housing communities in the Bay Area and an intergenerational program. We have some great videos on our YouTube channel that go over some of our programs here that you are welcome to watch. You can also visit seniorservicesnorcal.org to learn more about these programs and to donate if you wish. Sequoia Living is a nonprofit founded in 1958, and we have 3 affordable housing communities, 1 in San Jose and 2 in San Francisco, as well as our flagship locations, which are our life plan communities, also known as continuing care retirement communities. We have one in Marin County in the city of Green Bay. We have one down in Portola Valley near Stanford. And our newest community is called Viamonte. It's in Walnut Creek in the East Bay, as well as our 26-story community that's in San Francisco, right at the edge of Japantown. So I'm going to go ahead and get started with the program, and Dr. Nguyen's going to join us. I wanted to let you know that we're going to use the Q&A box today. So if you have a question for Dr. Nguyen, just type it in the Q&A, and we'll make sure that we spend time answering your questions. Dr. Nguyen, how are you?
Hi, Lola. How are you?
I'm doing great.
Good.
So you're a vascular neurologist. You've worked and studied in Texas and in Pennsylvania, but you are a Silicon Valley native. So you're back here in the Bay Area. And I hear that your wife is also a stroke specialist. Tell us, how did you get involved in selecting stroke as the specialty that you wanted to work in?
Yeah, well, in medical school, I became interested in neurology. So neurology has to do with anything related to the brain and the nerves in the body. So that really piqued my interest because the brain is just a fascinating organ. It's, there's so much we don't know about it and so much that's being discovered. So that was sort of the first thing that I got interested in. And then after that, I discovered the area of stroke or vascular neurology. And that really excited me because I felt like I could potentially help a lot of people. Stroke happens so often, and unfortunately to so many of us that it's something that we still are grappling with as a community and as a world issue health-wise. So and also just there's so many things being done in stroke. There's so much research, so much technology that's being helping people with stroke. So all that stuff kind of excited me and led me just to be a stroke neurologist.
And vascular neurologist versus regular neurologist versus cardiologist, which a lot of us think that cardiologists might have something to do with strokes. Tell us the difference.
Yeah, so a neurologist, as I mentioned, handles conditions related to the brain and the nerves, nervous system. So that encompasses, all sorts of different conditions, like not just stroke, but things like seizures, migraines, multiple sclerosis, Parkinson's, so many different things that a neurologist can potentially handle. But because of all those things, we have different subspecialties now. And so vascular neurology, that term refers to the arteries and the veins in the body, specifically the brain. So that's why people call us also stroke neurologists. So stroke neurologist equals vascular neurologist. And then cardiologists are physicians who handle conditions with the heart. So if you've ever had a heart attack or any other heart condition, you most likely have a cardiologist. Oftentimes, the heart is one of the culprits leading to stroke, and so that's why if you've had a stroke, or someone who had a stroke, oftentimes you might have a cardiologist involved to help with that part of it. But there are so many different types of causes for stroke. So it might be that you need more than just a cardiologist to help.
Great. Well, we're going to start with polling our audience. So I am going to launch a poll, and you should see on your screen. So poll number 1, which of these symptoms are symptoms of a stroke? So let's ask the audience. Is it a slurred speech, uneven face, arm weakness, vision loss, or all of the above? So we'll give the audience a chance to answer this question, and then we're going to dive into your presentation so we can learn what the symptoms of a stroke are. All right, give you just another couple of seconds to answer. We're almost at 100% here. Okay, I'm going to go ahead and share the results. So 98% of people said all of the above. So we have a very smart audience here with us, I believe. Yep. Okay, I am going to go ahead and turn it over to you, Dr. Nguyen, and you can share your presentation.
Thanks, Lola. Let me do that right now. Okay. All right, so let's, we're going to talk about stroke and what that is first and foremost. So what is a stroke? Stroke is when there's been a disruption of blood flow to the brain, causing some sort of injury and resulting in the symptoms that we'll talk about that you all saw in the poll as well. It can be caused by two main different causes. One is a blood clot to an artery in the brain, and that results in what we call an ischemic stroke. So on the left here, there's a cartoon of that where there's been a blood clot that causes lack of blood flow to the brain, to that dark purplish area there that you can see in the drawing. The other type of stroke is called a hemorrhagic stroke. So that's on the right here, where a blood vessel has actually burst open and caused blood to leak out into the brain itself. So both of these cause disruption of blood flow to a certain part of the brain. The more common type of stroke is the ischemic stroke, or the blood clot type of stroke. So 87% of people have that type of stroke. One of the take-home points for today is that without a CAT scan, and by the way, I think one of the questions that popped up on the poll on the Q&A so far is, can you tell the difference between these without, can an observer tell the difference? And the answer is no, actually, most of the time. There might be you might be able to maybe guess, but there's no way to know without a scan of some sort, whether a CAT scan or some other type of scan, to tell the difference. And for that reason, one of the take-home points is not to take aspirin or take any medicine of that sort if you suspect a stroke is happening, because if it turns out to be hemorrhagic stroke, you could actually cause that to get worse. Okay, so who does stroke affect? Stroke basically affects people of all ages and all walks of life. Age, however, is a risk factor in stroke. So when people reach about the age of 55, every 10 years or so after that, your stroke risk doubles. And women are more likely to suffer stroke than men because, well, most of that is because of the fact that women tend to live longer than men. So by virtue of age, unfortunately, one of the risks is that stroke risk is higher. However, like I said, stroke affects all types of people. So younger people are getting stroke more and more. Since the 90s, we've noticed that has been the case, and we don't exactly know why. We just know that it's happening. There are different theories out there, but this is one of the things that we're trying to understand. In terms of the U.S., stroke is a very significant medical condition. It affects almost 800,000 people every year, and it's the 5th leading cause of death in the U.S., and it's the leading cause of disability in the U.S. as well. On average, every 40 seconds or so, somebody out there is having a stroke, and every 4 minutes or so, someone is dying from a stroke. So it's a very, very significant a medical problem, not only for the patients, but for people who will need to end up changing their lives to care for stroke survivors, right? So there's all these different downstream effects from the impact of stroke. This is a map of the U.S., obviously, and it's showing you the incidence rates. So the darker purple are where strokes tend to happen more and more. And as you can see, there are regions of the country, particularly in the southeast, that are more affected by stroke. But it affects virtually, it can affect everyone and pretty much all parts of the country as well. We don't know why, though, that we have this pattern. There are theories. Some people think, could it be related to the diet, fried fatty foods that you find in the South, for example. We just don't know. The data has not identified a clear reason for that, but we know this is the pattern that we see. In terms of the ischemic strokes or the blood clot type of strokes, if you hear about this, you may hear the following terms. So you may hear about a thrombus, which is a deposit of blood clot that forms in an artery. And that's shown in the cartoon here with this plaque on the side wall of an artery here, as opposed to an embolus, which the only difference between a thrombus and an embolus is that an embolus travels somewhere else. So for example, if a clot starts in an artery in the neck, for instance, and travels to the brain, causing a stroke, that blood clot is an embolus because it had to migrate. So that's what causes an ischemic stroke, is a blood clot. Whereas a hemorrhagic stroke, as I mentioned before, is caused by leakage of blood from a damaged artery. And there are two big ways that this can happen. One is called an aneurysm, which is a weakening, or rather a weakened region of an artery. So this is an example. For example, look at this cartoon here. This balloon part of the artery is an aneurysm, and so the wall gets weak, and that leads then to the blood leaking out. There's also something called an AVM, or arteriovenous malformation. This is usually something that's from birth more often. It's an abnormal cluster of blood vessels that this tends to affect more younger types of people with hemorrhagic stroke. So those are the two main causes for hemorrhagic stroke. Now, you've probably heard of the term TIA, or transient ischemic attacks. Some people call these mini strokes as well. What is a TIA? TIA is when there's been a disruption of blood flow to the brain, but it's not permanent. So, perhaps a blood clot has gone to the brain, but then it dissolves, and then the blood flow is resumes, and then that leads to symptoms resolving. And so somebody may have, for example, slurred speech or weakness for a short period of time, but then they return to normal. So it's caused by a temporary blockage of the blood vessel in that case. And why are TIAs important? It's important because we regard them as warning signs for a stroke. Without knowing the cause for a TIA, there's a possibility that a TIA could be a warning sign that someone may be having a stroke in the next few hours or days, for example. So we know that people who have TIAs are about 9.5 times more likely to have a stroke. And so for that reason, it's really important to be evaluated as quickly as possible. And so, the TIAs are, the problem with TIAs is that it depends on who's calling it a TIA. If you have someone who's suffered a TIA, then oftentimes MRIs or scans of the brain will not show anything. And so it's really depends on who is diagnosing what a TIA is to be able to tell you what what that person's at risk for having and how significant that risk is. Okay, so now going to sort of our poll question in more detail. So what are the signs of stroke? Well, stroke is something that happens suddenly. So as you can imagine, if you have a blood clot affecting one part of the brain, it's almost like a clogged pipe where 1 second the water's flowing or the blood's flowing, and the next minute or the next second rather, the blood stopped, and so it causes a pretty sudden onset of symptoms. And so we in the stroke world are trying to get the word out by this acronym called BFAST. It used to be just FAST, but now we've expanded it rather to be called BFAST. And what does BFAST stand for? So as you can see here, B stands for balance. So if someone has sudden loss of balance, that could be a sign of a stroke. E stands for eyes. So any problem with onset of vision loss in either one or both eyes, or even double vision. It doesn't have to be vision loss, but double vision is also significant. F is for face, facial droop. So if somebody smiles and half of their face is not working, that could be a sign of a stroke there. A is for arm weakness. So the way we usually test that is to see if somebody can lift their arms up. And if one of their arms is not going up, that could be a sign of a stroke as well. S is for speech. So any problems with the input and the output of speech. So not just being able to talk or get the words out, but also trouble with the input or the understanding of what other people are telling them. Any type of confusion like that might be a sign of a stroke. And T is a reminder to seek help right away. T is for time, right? So what I wanted to mention earlier that slipped my mind when we were talking about cardiologists is that cardiologists, as you know, heart attack is the term for a condition affecting the heart, a blood clot affecting the heart. Some people call stroke a brain attack because the blood clot's affecting the brain. So we want people to understand the urgency of a stroke because it affects how often people can get treatment and how well people can do. People who've had stroke can do. And we'll talk more about that. Other symptoms. So these are less common, but still significant. You can get numbness or weakness of the arm or the leg. You can have confusion or difficulty understanding, as we mentioned earlier. You can also have headache with no known cause. So I'm not talking here about migraines per se, but if you've had a headache out of the blue and you're not one who usually has headaches, for example, that don't ignore that. You should regard that as something concerning until proven otherwise. Okay, so and now we've reached our first kind of break, and we'll see what questions you all have.
Dr. Nguyen, we have a few questions, and one of the questions is, these are ones that I got via email. What measures do we take until an ambulance arrives?
That's a good question. As we mentioned, don't uh, be concerned about giving them anything like aspirin. That's one important thing to keep in mind. But I would say the biggest thing is to make sure you've called for help. 911, or at the very least called somebody to your primary physician, for example. If not 911, to know what to do next. But in terms of what if your loved one or your friend or whomever is having a stroke right in front of you, the most important thing is to make sure that they're safe. This is a little bit of a tangent, but if, for example, if there's, sometimes things like seizures or other things can go along with stroke. If anything of that sort is happening, just make sure that they're safe. They're in a safe environment. They're not around people who have, they're not around, something that can endanger them. And I mentioned the seizures one in particular because if let's say somebody is shaking or is foaming at the mouth or anything of that sort, the best thing to do in that situation would be to put them on their side. So in case they happen to have something like they're like vomiting or they're throwing up, that they don't choke on their own vomit, for example. And this is an extreme thing, but just the message there is just to make sure that you keep them safe until you get help arriving.
And then Barbara says she lives in a retirement community in an apartment. And if she has a stroke or if someone she knows, should they go to the lobby while they're waiting for the first responders to arrive?
That's a good question. I think that, again, if they're not able to move, let's say in the worst case scenario, I would say just leave them where they are. Let the first responders help with that, because let's say you're on the second level or higher, or let's say you end up putting yourself at risk with moving them. You don't want to harm or put the stroke, the person with the stroke at risk of further harm, and you also don't want to harm yourself. So I think the best thing to do is just to call for help. Now, with the caveat that if you're in some kind of area that's not accessible or something like that, then of course, when you're calling for help, try to identify obstacles like that. But the best thing to do is just not do anything that you yourself is uncomfortable doing.
Thank you.
Yeah, that's a great question.
And then Gregory asks about migraines. Do migraines increase the chances of having a stroke?
That's a great question as well. We do know that migraines have a relationship with increased stroke risk. We don't know why exactly. There are different theories out there in the neurology world as to why that occurs. But so if you have migraines, I wouldn't sort of lose sleep over the idea of having a stroke, but I would take what we're learning about today as more power to understanding what you can do to lower your stroke risk. So that's a short answer to your question, but sometimes there are different examples of different types of headache, for example, that can be that can represent a different type of stroke condition. But so I can't say as a blanket rule or blanket statistic, for example, what your personal risk of stroke will be without knowing your medical history, but there is a relationship between migraines and increased stroke risk.
Great, thank you. And then we have a question that says, if my wife is having symptoms, should I take her right to the emergency room instead of calling an ambulance?
That is an excellent question as well, and we were going to get to that, but I'm glad you asked it up front. More often than not, our advice is to call for help. Don't drive yourself or your loved one to the hospital. And the reason for that is that a couple of reasons. One is that not all hospitals are equipped with the personnel and the resources to handle stroke. So when you call the paramedics or the first responders, they will assess the patient. They'll be able to identify, because they're also not only does every hospital not have stroke capability, but there are also varying levels of stroke capability. There are more advanced hospitals that take care of super advanced complicated, I should say, types of stroke, and then others that are less complicated, but still very equipped, very capable of handling stroke patients. And so, number one, you don't know which hospital can do that, and it's not something that you can find out online very easily. And the second is that if you were to arrive at the hospital, let's say you drove up to the ER and an ambulance drove up to the ER, the hospital is going to oftentimes, more often than not, treat the person who came via ambulance more quickly than the person who drove by car there. And then last but not least, for safety reasons, you don't want to drive somebody, or even worse, drive yourself if you think you're having a stroke, because you could be injuring yourself or others in the process.
Thank you. We will have more time later on in the presentation to answer more questions.
Okay, great. All right, so a few more statistics here. So in the stroke world, we like to say time is brain. And so, we're already starting to talk about that theme here. So every minute, the thought is that 2 million brain cells die after a stroke has happened. And these are statistics that are that UCLA came up with years back that are very, very important to driving this point home. The second thing is that there's a limited time window for stroke treatment. Now, we're going to get into this in the next few slides, but strokes, if strokes and people who have stroke come to the hospital sooner rather than later, we may potentially be able to offer treatments. And so one of those treatments is a very powerful clot busting medication or very powerful blood thinner called TPA. And so it's been shown that the longer that somebody waits to come to the hospital, the less effective that medicine can be. And every 10 minutes even that's extended in terms of a delay can result in not only decreased benefit from that medication, but a lower chance of that person regaining their functional independence after stroke. And then the other thing to keep in mind is that, unfortunately, the majority of stroke patients don't come to the hospital soon enough to receive or even be considered for this medication. So there's only about 10% of people who have stroke and otherwise can be treated with a medicine like TPA show up to the hospital soon enough to be able to get it. And so it's important to realize that stroke is not only preventable, but as we'll talk about toward the end, how to prevent a stroke from happening, but it's also treatable and beatable as well. So 80% of all strokes can be prevented with healthy behaviors. And the sooner people get treatment for stroke, the less likely they'll be impacted by the effects of stroke moving forward. And more people are surviving and beating stroke. Without getting into the politics, I mean, if you all are following politics, you know that there are people out there who are running for office and having stroke as well, and they're able to live productive lives after their stroke. So it's just like another take-home point to know about stroke is that it used to be that stroke, we thought there was nothing we could do about stroke, but that's changing rapidly. So I talked a little bit about TPA, which is the medicine, the clot busting medicine that we have. And I see a question that popped up in the Q&A about what the time frame for that. That's a good question. The overall time frame for that is about 4.5 hours. But I would say don't set that in stone in your mind. Again, just I sound like I'm a broken record, but the most important thing is to go to the hospital right away, because even things are changing. 4.5 hours is the time window that is out there in a lot of the studies, but those research studies don't apply to everyone. Some people may have less of a benefit, as I mentioned. depending on the time frame, some people may have more of a benefit. So, and also if somebody shows up to the hospital at 4 hours and 29 minutes, there's no way for us to give that medicine within that minute of time, right? So there's a lot of preparation, a lot of things we have to do to make sure that people can even receive this medication in a safe manner. So that's a TPA, or the clot busting medication that you'll hear about. There's a second treatment for stroke that involves a procedure called endovascular clot retrieval. Some people call it intraarterial treatment or therapy. And what that is, it's a fancy way of describing this catheter device. So if you've ever heard of a cardiac catheter, where a specialist can go in through an artery and sort of snake a catheter all the way to the heart, we can do that now as well to the brain. So we can go from an artery in the leg or even the arm and bring a catheter all the way up to the brain and to the site of a blood clot and remove that blood clot with a very small device. And that time frame is a little bit longer, but it's still something that is better treated sooner rather than later. So the other thing to keep in mind is that these two treatments, not everybody qualifies for them. So you may have a stroke patient who ends up receiving TPA, for example, that clot busting medication, but they don't have the right type of blood clot to be able to get that endovascular treatment and on the right hand picture there. So this is just so that you all know what we can do and we consider for people, but not all strokes can receive these treatments. It just depends on the type of stroke and other qualities regarding the stroke. Okay, and then this is a little bit more about that endovascular treatment. So on the left-hand side of the screen, you see the two panels, the A and the B here. The A panel is a depiction of one's blood vessel. So this is an example of a blood vessel that's been blocked. So as you can see in this big arrow on the bottom of the screen, the big white arrowhead, you can see that the artery ends right there at the arrowhead. And then after they've received this treatment where a catheter is brought into the brain and the clot is yanked out, then the blood flow is reestablished. And you can see on panel B that there's blood flow again back to that blood vessel. And then on the right-hand side of the screen is an example of that little catheter. And it's a catheter that kind of opens out to be like if you've heard of the stent, it's like that, where it can encapsulate the clot and help remove it from the brain. One other thing I wanted to mention, that you may encounter is the advent of telemedicine. Telemedicine is actually most of what I do on a day-to-day basis, and telemedicine, as you all probably know, it allows us to see people virtually. So this is an example of a stroke neurologist down here behind a computer, and they're able to virtually evaluate this stroke patient who's in the hospital here using this computers on wheels, as we call it, with a camera mounted on top that allows us to assess the patient, and also it allows us to be at a situation where we can look at their CAT scans and their medical records as well. So this is a really important technology because for a couple of reasons. First, it allows us to get to people with stroke right away as fast as possible, as humanly possible. It's even faster than if I were to drive to a hospital and get there in person. The second is that unfortunately there's a shortage of neurologists, especially stroke neurologists, in the whole country. So we're just not able to cover every single hospital. And so this allows us to get to people very quickly, like within within minutes or even seconds of people arriving at the hospital, the emergency rooms can page me and get me on the camera. And then we can save precious seconds to try to get to your stroke. And so this is something that you may encounter if you're in that situation. This is just an example also of a CAT scan. And this is just to show you what is evolving with the technology. So in the past few years, we've been able to do so much more with technology in terms of even imaging, for example. So this is a picture of a CAT scan, and it allows us to show, to understand how much of the brain has been affected by stroke and how much of it is already far gone. So meaning that here's an example of one person's brain. The purple is an area that's already been affected permanently by the stroke. But as you can see, the green area is much bigger than the purple area. So the green area, what this tells me is that this person may benefit from treatment out there because they still have a lot of green area to save in their brain. This is just, a very, a kind of basic example of how the technology is evolving. Another thing that's out there is something called the mobile stroke unit. And this is something that you may hear more and more about in the years to come. But in certain parts of the country, there's an ambulance called a mobile stroke unit. And that ambulance is actually equipped with a CAT scanner and a telemedicine machine inside, which allows us to even evaluate people even outside of their home. So if let's say the paramedics hear or dispatch a first responder with this to a location with a possible stroke, this mobile stroke unit can potentially meet them wherever the stroke is happening. And then we can even get the treatments to the patients faster, saving even more time. But this is not a completely proven technology yet. So that's why it's not widespread, but you may hear about it in different parts of the country. Okay, so I'll pause here for our second round of questions.
All right, thank you, Dr. Nguyen. So Lynn asks, what's the time frame to treat stroke with TPA?
Yeah, I saw Lynn's questions earlier. So that's the 4.5 hours that we talked about earlier. But again, that's just a measure that, I would not remember that because like I said, if you get to the hospital close to that 4.5 hour mark, then it may or may not be enough time for us to do all that we need to do to get that medicine. So it's always, if at all possible, better to come to the hospital sooner than that, so that we can give the medicine if possible, even more quickly than that. But yeah, it's around 4.5 hours, just to answer your question.
Yeah, and one of the statistics that I heard, I believe only 30% of people who are experience a stroke actually go to the emergency room. Is that correct?
It's a low number, lower than we want it, for sure. Because and we'll talk about that as well. And it leads to what we discussed earlier about what you should or shouldn't do. It depends on the symptoms, but so sometimes you might be surprised, but from my standpoint, I see this a lot where people they may not have very severe symptoms. They may have even weakness of one arm or one leg, for example, and they'll say, okay, well, I didn't come to the hospital right away because I thought if I slept it off, it might get better. But but if it's bothering you, especially if it's debilitating, by all means, don't wait, because
Right.
there might be something we can do about it. Right.
Well, and one of our viewers shares some of his personal story with us about having some symptoms coming on gradually and then having to spend time in the hospital and having some tests. So Dr. Nguyen, tell us a little bit more about gradual symptoms versus versus symptoms just coming on all of a sudden. And, in this case, this gentleman is wondering if he was having a TIA, but he's had all of the studies. So, if the symptoms are gradual, should we be concerned that it is a stroke?
Yeah, so that's hard to answer globally. I think, and I'm trying to absorb your, thank you for sharing your experience there. I'm trying to take out the most salient points of what you're asking. But I think that it's oftentimes it is sudden in terms of stroke symptoms. But it just depends on the situation. The stuff that we talked about before, like BFAST, those are the most common symptoms of stroke, for example, but they're not all encompassing. Stroke can, and it sounds a little bit broad, but stroke can do almost anything to the brain. And in terms of time, though, in general, if it's something more gradual, it's less likely to be stroke. But when in doubt, especially if it's something potentially disabling, don't delay, go to the hospital and let us try to diagnose it, because that's part of our job, right? Is to try to diagnose that. And sometimes, and maybe this answers that question a little bit, is that there are some symptoms that can overlap with other conditions. Sometimes, for example, people who've had seizures, if somebody's recovering from a seizure, they may have weakness of one side of the body, and it may look like stroke, but it just depends on what time point that we're observing people through these symptoms.
All right. Well, thank you for sharing that information. And Sue makes a good point. She says, if you're waiting for the ambulance, make sure your door is unlocked. That'll help out a lot. Yeah.
And another one, if I might throw in there as well, especially if you're not going to be able to go to the hospital quickly with your loved one who's having a stroke in front of you, and hopefully you're never in this situation, but make sure that the paramedics have your number, because sometimes we're almost like detectives in the ER. Sometimes somebody unfortunately will show up in the hospital, and they'll have a stroke right in front of us, but I'm not able to communicate with them, and the paramedics won't have a vital piece of information that a loved one like yourself at home may have. So make sure that the paramedics have your contact information in case they need to get in touch with you for A, B, or C.
Great point. All right, we'll get to more questions later on, but let's go ahead and move on.
Okay. Yeah, so we already talked about this essentially, but what should you do if someone's having a stroke? Again, by all measures, if you're not sure, especially if it's happening suddenly and it's potentially disabling to you or somebody else, call 911. Don't wait. And why, again, shouldn't you drive to the hospital? Again, it's because you don't want to be at the wrong place. The paramedics, the first responders, can help bring you to the right place, or and get the exact care that you need, as well as to make sure, like we talked about earlier, that you're safe in that whole process. And last but not least, also, it allows us to get a heads up. So oftentimes, like I mentioned earlier, I'm called by the ER, but sometimes I'll even get a pre-call. Like the ambulance will call the hospital, and then the hospital will call me and say, hey, there's this stroke patient coming to the hospital in 2 minutes. And so I'm ready. I'm on standby, ready to help. So, all these are things that, little bits of time are saved, but all these little things can add up to save a lot of time. And so, yeah, I'll just, I think that's pretty much this slide. So now let's talk about how to prevent a stroke. I think the biggest thing to take home is that, make sure that you have a good relationship with your primary doctors, that you go to them regularly for just routine checkups, if not other things that they may advise. And this is a kind of a basic analogy, but it's almost like you're maintaining a car, right? Like if you go to the mechanic every now and then to get your car serviced. So same thing with your body. Even if you're feeling completely fine, no matter how old you are, it's really important to get checked up, because you want to make sure that things like your blood pressure are under good control, and blood sugar as well, things like that. So these are some of the things. So I'll just go through these here on the screen. So I mentioned blood pressure. Blood pressure is probably one of the most, if not the most important thing to treat to lower your stroke risk. Another thing is in terms of smoking. Avoid smoking at all costs if you can. If you are smoking, quit. There are so many different ways to quit smoking now that we can help you with that as well. Cholesterol is another risk factor. That not only through medications potentially, but also through diet. We always want to try to control our diet first, but diet and then medication if needed to lower your cholesterol. Like I said, with blood sugar, trying to maintain that, making sure that you don't have diabetes, that you don't need treatment for that. And then losing excess weight, because weight can play into these other things that we mentioned, blood sugar and blood pressure as well. And then exercise is also important. So 30 minutes a day, 5 to 7 days a week, trying to bring up your heart rate so that you can maintain your health that way as well. A little bit more about blood pressure. Like I said, it's probably the most important risk factor for stroke. Our goal blood pressure is usually anything less than 130/80, but consult your physician about that, because you may have things that can affect that as well, your goal there. So I always advise people to have a blood pressure cuff at home, and also to try to record your blood pressure readings so that you can bring those to your primary doctor or your stroke doctor as well, to see over time what the trend is with your blood pressure, and whether you need to get treatment for that. Okay, so now it's time for our second polling question.
All right, let me launch our poll. Poll number 2. What not to do if you believe or you're having a stroke? 1, drive yourself to the hospital. 2, take aspirin. 3, go to sleep, take a nap. 4, all of the above. So what should you not do if you believe you are having a stroke? We'll give everybody a moment to answer. This is a quiz because all of these answers were just given. So now this is what you'll have to remember to keep yourself safe if something happens. Okay, I'm going to go ahead and end the poll and share the results. So can you see that, Dr. Nguyen?
Yes, absolutely. So everybody did really well. There was 6% that said that you should not take aspirin. That's technically true, but basically everybody was thinking the right thing, except that all these things are things that you shouldn't do as well. So like we said, don't drive yourself to the hospital. There are many reasons for that. And then don't go to sleep. Don't disregard that as well. So all those things, as well as not to take aspirin before. Again, the most important thing is to seek help for if you're thinking the stroke is going on. Okay, so let's. So a little bit about diet. So I have to give a major caveat to this slide, because I'm not a nutritionist, and also your own specific dietary needs may be affected by something in your medical history, right? For example, right? So, we like to oftentimes talk about the Mediterranean diet because it's the biggest type of diet out there that has the most sort of healthy types of components to it. So Mediterranean diet consists of a lot of olive oils, a lot of fish, and a lot of very organic things, fewer red meats and processed things in a Mediterranean diet. So overall, we like to say, if in terms of a diet globally for people who had stroke, or even before you've had a stroke, you should always try to avoid fried fatty foods if at all possible, and adhere to more of a Mediterranean diet. But again, consult your physician or nutritionist for or a dietitian if needed for more on that. And then last part of my talk, I just wanted to mention briefly about sleep disorders. Sleep is in an area that we're learning more about, and we are learning that there's a lot of interplay between sleep and quality of sleep in relation to stroke as well, and heart disease for that matter. So this is just a list of some major sleep disorders that have been linked to stroke. And one of those in particular that I'm sure many of you have probably heard of is something called obstructive sleep apnea, or OSA. And what that is when you're asleep, the tissues in your throat and the back of your neck get relaxed, and so that leads to a blocked airway. It leads to snoring most oftentimes, but what this even more important than waking up your significant other next to you in bed maybe, is that this can over time cause you to have a harm to yourself. It can lead to increased blood pressure. It can lead to increased rates of cardiovascular disease as well as stroke. So if you snore, or if your loved one snores, and especially if you think that they're not breathing well during sleep, I would strongly recommend that they be evaluated for sleep apnea, because the treatment can help lessen that as well. And then this is my the last slide for that, which shows the interplay between stroke and sleep. So stroke can lead to physiological changes that lead to sleep disorders, as I showed you in that list of the sleep disorders that are linked to stroke. And then it can also have an interplay with one's psyche. And so if you have stroke and then you're not feeling yourself, you're not your normal self, that can affect your sleep as well. So there's this interplay between stroke and sleep that we're just beginning to understand, and then all that leads to and has effects on various things in terms of not only our mental and physiological health, but our ability to function in the daytime, and then also our quality of memory as well. And then all that in turn leads to or can influence our stroke outcome and how we do after stroke. Okay, so and this is my closing slide. For more on stroke, visit these websites. The American Stroke Association is the national one, and then the Pacific Stroke Association is more for the Bay Area. These are two very important associations that are helping our stroke survivors out there. So.
Dr. Nguyen, can you go back to your slide on the Mediterranean diet? A few people would like to see that.
Sure.
Again. And I'll also make sure that we send out this information via email. So you'll get a link to the video as well as additional information that we've seen here, such as this Mediterranean diet. We have a few other questions that have popped up, and we have a couple of minutes to answer them. So one of the questions is around aspirin, and some doctors recommend to take aspirin on a daily basis, which helps with cardiovascular disease. How does that impact a risk for stroke?
Yeah, so I think this is a question where you should consult your your physician. I'm sorry, there's a glare here. There isn't a one size fits all answer for this because, again, there's so many factors that play into this. But if somebody has never had a stroke ever, there isn't that much good quality, high quality evidence to suggest that taking an aspirin will help against stroke, but you may need to be on it for some other reason. Let's say you have heart disease and you need aspirin for that. So that's why first, don't think of stroke by itself in that way. Stroke oftentimes is a consequence of many different things that can play into each other. But to answer your question with the aspirin in particular, I would defer that to your primary doctor for the best advice.
Thank you. And then we've had a couple of questions around stroke and trauma centers in the Bay Area. And one of the questions was about if there's advancements, why do some facilities not have those advancements? So can you tell us a little bit more about the trauma centers in the Bay Area that may be better than others?
Yeah, well, so this is, so let me start with the trauma part. So each hospital has different certifications for different things like trauma and heart attack and stroke, for instance. Trauma, I think the part of the question was asking whether stroke is a trauma. Stroke is not technically a trauma, but it can present as a trauma. Oftentimes, unfortunately, I'll see people who have had a stroke and then they'll, for example, they may lose their vision and they may be in the car when this is happening and it leads them to be in an actual trauma like a car accident, and then they'll get to the hospital and then somebody down the line will then realize, okay, well, this person may be having a stroke. Let's call the stroke specialist in. So it may present as a trauma, but it's not a trauma in that sense. The other question I think was related to TIA, if I'm not mistaken, and the resources behind that. So it's a complicated question to answer, but and that's because, like any other things, that affect us all, it's a question of more like resources utilization. And so, like I said before, not all hospitals are stroke centers. Most are nowadays, but it's too complicated of a question for me to give a global answer on. Again, I think the safest, the best thing to do always is just to let the professionals handle that question in terms of when you're in the phase of getting someone to a stroke center, because there are different things that play into that. In terms of TIA specifically, there are different ways that they can be treated as well, people with TIAs. Sometimes people with TIAs may need to stay in the hospital. Sometimes they may be able to be to go home and not stay overnight in the hospital, but it just depends on, again, different factors. And so and I'm sorry that that's the answer, but I just I can't account for every single possibility out there. So the safest thing is just, when in doubt, seek attention first, and then,
Thank you. Yeah, it's no different than if you had a pediatric situation where you have a small child, the ambulance is going to take them to the best hospital for their needs, right? So in this case, it's the professional's job to assess the emergency. Yeah. Great. Well, thank you so much, Dr. Nguyen. I do want to thank our sponsors one more time, Senior Services for Northern California and Sequoia Living. We have more educational webinars on our website at sequoialiving.org/webinars. And then we also have a YouTube page. So this recording will be sent out to everyone who signed up for today's presentation, as well as posted to our YouTube page. Thank you again, Dr. Nguyen, and thank you everyone for joining us.
Thanks, Lola. Thanks, everybody. Take care now.